Yes, I've just used laser for pre-treatment. Let me think. It was breast cancer, and pre-treatment was performed. Also, veterinarians do this often. If there is a tumor, they will perform such pre-treatment and reduces the size of tumor to a minimum and then simply remove it. Otherwise, the therapy would continue for a long time, and it is desirable to get rid of the tumor as soon as possible. And in this case, the same can be done, i.e. this therapy can be used to pre-treat and reduce the tumor. In conventional medicine, this treatment technique is also known. It is called neoadjuvant chemotherapy. At the same time, chemotherapy is used to reduce the tumor size so as not to operate on a very large area. Previously, it was different. First, a surgeon performed a surgery, and then the chemotherapist would start his treatment. Today, with the help of neoadjuvant chemotherapy, it is performed first and then followed by surgery. Here, this can be done also with laser therapy and photodynamic therapy used in the same manner as neoadjuvant chemotherapy before surgery. Regarding photodynamic therapy, I can tell you that a laser can be used on those areas that prove to be very complicated in terms of surgery. For instance, we had patients with tongue cancer, tonsil cancer, throat cancer, larynx cancer, which commonly would result in laryngectomy. All I need is to insert laser probe to direct the laser to a target area. Then prostate cancer, bladder cancer. The bladder is preserved. Recently, I had a professor from Russia who's over 90 years old. He needed to undergo a bladder removal surgery, but we did not do that. We just inserted a catheter in his bladder. This is very simple. While doing so, the entire bladder is exposed to radiation, and therapy is directed at the targeted area. Thus, the bladder is preserved, or the urethra or ureters where the laser can reach. I had cases of anal cancer, and I have scans that show even anal tumor prolapses, and we are able to treat that. Yes, and the sphincter can be preserved because conventional medicine tells you that you need to get rid of all that. We reduce the tumor and only remaining cell nests are removed surgically, but still the sphincter is preserved because we can use combinations all the time. This is the best suited therapy for the remaining tissue. I had a case of lung cancer, a sarcoma in both lungs. 7 to 10 years ago. Both lungs were affected, and in the end, I knew there was still a small area that would not be reduced. It was removed in Berlin in Charite Clinic. The doctor who performed the surgery said that it practically fell out since it was encapsulated. The human body tries to encapsulate everything when it tries to cure itself or this fails. The surgery lasted half an hour, and after 30 minutes, it was all over. It's not because the patient did not want to. She would not have survived it. She would not have handled chemotherapy since she was very weak. Also, in case of sarcoma, we do the same. Yes, a lot of things need to be combined. This can also be used to treat Ewing sarcoma, which is far more severe since in such a case, long bones are affected and the tumor cells are very aggressive. Here we also need to combine very difficult techniques. On the whole, one should comprehend that there is no such thing as a simple injection, and the best results can be achieved only by combining. We combine treatments, but also offer conventional medicine. Since in cases where chemotherapy will evidently be successful, e.g. Hodgkin's lymphoma, malignant lymphoma, this course of treatment should be followed.